little old lady, she came in, she like had left-sided droop on her face, her arm wasn't working. So we got her down to the head CT, everything was good. We started the medicine. Her two daughters were here and they were just watching all this go down.
A stroke is when somebody has facial drooping, or they can't move their arm or their leg. They have some sort of deficit that they can't move their body like they normally were able to move their body before. And a lot of times that can be caused by two reasons. It can be caused because somebody has a bleed in their brain, like a blood vessel is burst and they're having some bleeding up there, or it can be caused by a clot. We get a whole group of professionals surrounding the patient when they immediately come through the door. People to draw their blood, people to put their IVs in, people, in fact, we actually clear our CT table from all other patients to get that patient on the CT table as soon as possible. We need to know what's happening to that patient. But we can also deliver TPA. TPA is a clot buster. So if it is a clot that's causing these stroke symptoms, we administer that medicine and we can get that clot busted and open up those vessels again and get that blood flowing so that people can get those deficits, those things that they've lost function in their body, they can start getting those back. The biggest thing is to be able to get that medicine, we have to get people in here fast. So if people start having symptoms, they need to be evaluated by a physician as soon as possible. If you drive yourself and the stroke has only started, it could get worse. So you put yourself at risk for getting in a car accident, but you put others at risk too. So calling 911 gets an expert who is able to do pre-hospital medicine at your doorstep as soon as possible, put IVs, draw blood, and get you to the hospital for evaluation by a physician. FAST is one of the acronyms you can teach your family members to kind of help teach them about ways to watch, make sure that you're safe from having a stroke. So FAST, F stands for facial droop. Any changes in the face that happens on one side but does not happen on the other side. The second thing is any arm movement, lack of arm movement that happens on one side of the body but does not happen on the other side. Slurred speech is another way to be able to tell that somebody's having problems if they're not communicating well. And then time. How long has this been happening and how quick can you get into that ER?
The little lady that we started TPA on, she did go upstairs, but she was improving as we were taking her up. Her speech was improving, but it started in her hand. I remember that her hand started working and her daughters were standing over her. You could just see her start resolving. It was just really positive to see this lady start to improve before we got to take her upstairs. So.